Hello everyone, welcome back. Now we're going to be talking about the radiology aspect of the kidney disease. This is important because as I go through the various diseases, I will be using some of these investigative procedures and I want one to be aware of what I'm talking about. So among the various different radiological studies that are available, the simple and the basic is ultrasonography. This is really a very helpful and a quick test, although in young kids it can be very challenging. It gives you a lot of information. Then you have CT scan without IV contrast, magnetic resonance imaging, MRIs. A plain film of the abdomen can tell you a lot of things, like constipation is one of the most common cause for repeated urinary tract infections in kids, which you can detect it on the plain film of the abdomen. Intravenous urogram. You have renal arteriography if you are suspecting any vasculature issues, renal venography. Then you have widening cystourethropy, which is VCUG. In this study, I would like to explain you this a little bit more, and also the red things which I have highlighted is these three studies are very commonly used in outpatient settings in pediatric nephrology to diagnose various diseases, and these are the three most commonly used investigative studies. So after ultrasonography, let's look at what is VCUG. VCUG has two phases. One is called as passive filling phase, and then second one is called as active widening phase. You put in a Foley catheter, fill the bladder with a contrast agent, and as you are filling the bladder, you look it under the fluoroscopy camera. When you are passively filling the bladder, you try to see if there is any reflux of the contrast material into the ureterus. If you see so, then that is a positive study. After you fill the bladder, you take the Foley catheter out, and then now you let the kid pee that contrast. When the kid is micturating, you see the reflux, which is not normal, meaning the contrast material should just smoothly come out of the bladder into the urethra, but when the pressure in the bladder increases, there may be some reflux of the contrast agent into the ureterus, suggesting there is a reflux. There are different grades of reflux, starting from grade 1 to grade 4, and then you classify accordingly based on your VCUG and ultrasonography. So this is the widening cystourethrogram. The one thing you are here, as I said, in the active widening phase, you are at the mercy of the kid. So if it's a young infant, then you just have to wait until the kid pees out the contrast agent. The next one is the MAG3 scan, or the radionuclide study, and this is a functional and an excretory functional assessment of the kidney. You inject a radionuclear agent into the peripheral vein. That agent is picked up by the proximal tubules, and they say the particular agent which is used in the MAG3 scan is absorbed around 60 to 70% in the first pass. So it's taken up by the proximal cranial tubule. So that is the functional part, and later on it will be excreted into the tubules, comes out into the collecting ducts, and then into the renal pelvis and the ureterus. So what you see is that as the time goes on, you will see that the kidneys will light up because now they have taken up the contrast agent. If one of them is absent, then it won't take up. So with this, you can even look for ectopic kidneys when you have unilateral kidney, or when you are not able to see kidneys in the normal position on ultrasound and you are not able to find, you can do a MAC3 scan. So MAC3 scan is important to assess the function of the kidney, and it can also tell you the excretion if there is any blockage in the ureter. As I said, the second part of this scan is the excretion of that radionuclear agent into the ureters. You can augment that process by giving Lasix, which will speed up this process, and that is why sometimes it is called as a Lasix nuclear scan. There is a graph that you can plot, and you see this is the uptake by the kidney and the slow excretion that happens. Any change in this graph can tell you if there is any obstruction of the kidney. So by doing MAC3 scan, you can come to know two things. One is if there is a functional kidney present or not, and second, if there is any obstructive hydronephrosis. Thank you.